It is cardioprotective in the heart. It improves cardiac function, decreases blood pressure. In the brain, it is protective. Insulin is active in the brain, and it is neuroprotective in the brain and decreases appetite centrally in the brain as well as the stomach. So the GLP-1s it also benefits from an immunologic system. So GLP-1s have an effect on pretty much every important organ in the human body, beneficial effect. So how do we reduce the nasty side effects? Number one, if you are going to use a GLP-1 agonist, make sure that you are enrolled in a metabolic physician-supervised program with regular visits. In my practice, those visits are with me personally, as well as Cheryl, our certified diabetic educated dietitian. And those visits help you to change your behavior, help you to change your diet to fit better with a GLP-1 agonist so that you are embracing the medication and bringing your side to the table. We give you that guidance and we give you the support. Very, very important. Okay? Remember that AA does not get people to quit drinking. AA helps people who did quit drinking to change their behavior so that they don't relapse back to drinking again. That's what we do in the office. Secondly, a medication must. You must be on a low carbohydrate, high fat diet. Whether that's more omnicarnivore or carnivore or even vegetarian, you want to make sure that you are getting in adequate protein, because otherwise you will have the muscle loss, and you want to protect that protein with adequate fat. So protein and fat is your macros, and then also making sure you're getting adequate micronutrients into your diet, because you're eating less, you're losing weight rapidly, you still need to get bang for your buck. So if you're eating salads all day long, it is not, if you're only eating a small salad because you can't eat more, that's problematic nutritionally. Not because I'm against vegans or vegetarians, but because there's not adequate nutrition in there. If you're eating an egg, if you're eating some fish or seafood, if you're eating a steak, there's much better nutrition in that food. To the extent that you can, and I recognize some people are limited by their physical limitations, but to the extent that you can, you must be in an intentionally physically active program where the frequency with which you are intentionally physically active matters far more than the intensity. I don't care whether you go to the gym or not, but I want you to go for a walk. I want you to be opportunistically and intentionally physically active, because that protects your muscles, protects the other things, and also changes your mindset. You absolutely must, if the effect is going to be sustainable, be in a cognitive behavioral therapy, AA for fat people. And in our program, you want to have at least one visit with Erin, our psychiatric nurse practitioner, not to talk about you being crazy. We know you're already crazy, okay? We know that for a fact. No, this is to help you to understand the behavioral changes, the addiction or the substance abuse aspects. Because by the time you're obese or have type 2 diabetes and you're using the GLP-1 for that, your relationship with sugar and starch is out of control, no matter what you think. And that behavioral change, supported by Erin from the psychological perspective, is as important as the diet. Changing why you're eating is as important as changing what you're eating. My job is to monitor blood work. And a must for me, if you're going to use a GLP-1 agonist, is to monitor your blood work, to see what your baselines are, and then to monitor that blood work and to make changes as we go. And we also help you, the final step at home, is to monitor your blood glucose, to monitor your ketones, either with a Keto Mojo or a Dexcom CGM, to monitor your blood pressure, to monitor your heart rate, and to monitor your cardiac rhythm. If you are not doing that, then you might as well rub your GLP-1 on the wall rather than swallowing it. You won't have all the side effects because the long-term benefit is just not going to be there. And all of my patients are experts at failing weight loss programs. And for the majority of people that use GLP-1 agonists prescribed by their doctors as monotherapy, they become part of that population. Oh, kumbaya, I lost a lot of weight, but I gained it all back.